which are classically spared. When I say classically spared, what does that mean? That they are classically not involved. They are only have already come to the conclusion. We have already come to the conclusion that most common joint in osteoarthritis is the maximum weight bearing joint, that is knee. All right, hello everyone. This is Dr. Tushar Mehta. I'm an orthopedic surgeon and a faculty of orthopedics. Well, in this video, we have to talk about a very important topic and an interesting topic, which is not only required for UG students but PG aspirants, PGs as well, and even the practicing doctors. That if we get a patient, then how do we make a diagnosis of osteoarthritis depending upon just the pattern of joint involvement? See, guys, osteoarthritis, as we know, it's an age-related process. That's why it is called as age-related arthritis, degenerative arthritis, wear and tear joint disease. Well, as we age, definitely there is a tendency of the joints of our body to develop osteoarthritis, but primarily that will happen in the weight bearing joints. So we need to understand today that what are the common weight bearing joints which are involved. So in the common weight bearing joints to be involved in osteoarthritis, we talk about the first joint, which is certainly the knee, which is technically the most common joint involved. Second common weight bearing joint is hip. The third common weight bearing joint is knee. All right, so these are the three very commonly involved weight bearing joints. Now, that does not mean, I insist, please understand, that does not mean that osteoarthritis is an exclusive disease of weight bearing joints. No, it can also involve non weight bearing joints as well. So what are the common non weight bearing joints? So common non weight bearing joints which are involved in this condition: number one, they are proximal interphalangeal joint. Number two, they are distal interphalangeal joint. Number three, they are first carpo metacarpal joint. Number four, they are first metatarsophalangeal joint. So technically there are four non-weight bearing joints, which are PIP, DIP, first CMC, and in the foot, first metatarsophalangeal joint. After understanding the common weight bearing joints and the common non weight bearing joints, we need to understand the joints which are classically spared. When I say classically spared, what does that mean? That they are classically not involved. They are only two. The first one is wrist joint, while the second one is metacarpophalangeal joint. So again, I insist that the two joints which are classically never involved are wrist and metacarpophalangeal joint. I can tell you why they are classically not involved in osteoarthritis, because they are usually classically involved in rheumatoid arthritis. So this is the classical joint pattern involvement in a condition called as osteoarthritis. So whenever an elderly woman comes to you, the first thing that she says that she has pain in the knee, which is not allowing her to even go for a morning or evening walk, followed by some pain in the hip while getting up from the commode chair, and then of course she has backache. And then you take an initiative, because weight bearing joints will be more troublesome, so she'll come with those problems, and then you take an initiative of clinical examination, and what you see is some enlargement of PIP joint, some enlargement of DIP joint, or maybe some sort of a difficulty in movement, painful movement of first metacarpal joint. It is at that point of time you will say that, ma'am, you are 66 plus or 60 plus, most likely you have osteoarthritis. Ma'am, one question: do you have any involvement of the wrist? He says more likely no. Any involvement of the knuckle metacarpophalangeal joint? She'll say most likely no. Moving one step further, since you have watched this video till this moment, so I want you to understand that in osteoarthritis of knee, see, we have already come to the conclusion that most common joint in osteoarthritis is the maximum weight bearing joint, that is knee. But in osteoarthritis of knee, can you people tell me which is the most common bone involved? It's not femur, by the way. It's not even tibia. It is that cute looking little bone called as patella, which is the most common compartment which is involved. Before I tell you about this, I want to share a fact with all of you, that our knee has a weight bearing axis which does not pass through midline of the knee. It passes slightly middle to midline. So most common compartment to develop this problem is medial compartment. Now, which is the most common muscle to develop this problem? By the way, there is a muscle called as quadriceps femoris, which has got four parts: rectus femoris, vastus medialis, vastus lateralis, vastus intermedius. Out of these four muscles, which is the most common muscle to be involved, it is vastus medialis obliquus. It is vastus medialis obliquus, which is technically VMO. The first muscle to undergo degeneration and atrophy is this. Since we have spoken about this, I think we need to talk about one more thing. I hope you remember that I told you that the two common non-weight bearing joints are PIP and DIP. And if you remember something that I said just a few minutes ago in this video, that you have to take an initiative and you have to look in that hand so that you can find symmetrical enlargements of PIP and DIP. Now, these symmetrical enlargements that you are looking at in PIP joint and in DIP joint, so these symmetrical enlargements are basically what are called as Bouchard nodes and what are called as Herberden's nodes. All right, so these are the two symmetrical enlargements. So this enlargement here, if an elderly woman has Bouchard node, this is basically her burden node. So in this video, guys, not only we spoke about the pattern of joint involvement in osteoarthritis, we talk about the common weight bearing joint, the common non-weight bearing joint, and even the joints which are classically spared. Why they're spared? Because they have to be involved in one more topic called as rheumatoid arthritis. And then in osteoarthritis, most common bone, most common compartment, most common muscle, and then what are the two important deformities that we see. I hope by watching this video you have benefited in your knowledge of orthopedics as an undergrad student or a PG aspirant or even a postgraduate. I wish you guys all the best. Stay tuned for more videos. Do like, share, and subscribe to the channel. God bless.